The latest technology, services, and research in the industry. It's only at Anesthesiology 2017. Welcome to ASA TV. I'm Ed Highland. Here at the 2017 annual meeting, physician anesthesiologists are emphasizing that every aspect of the specialty has the opportunity to lead in patient education and perioperative care. Dr. Lee Fleischer delivered a powerful message to a packed house for his Emory A. Rovenstein lecture. Dr. Fleischer says the profession has always embraced a patient-first philosophy, and from pre-op counseling to post-surgical prescriptions, we must take ownership of the surgical journey.
And we need to take joint accountability, that shared accountability, for not only processes that we control, but outcomes that we can influence. Because if we don't, the whole house of medicine, the whole perioperative period will sink, not just us alone.
His message reverberated with attendees.
I definitely think what he said is very important, and it's easy to kind of forget that when you're standing there trying to talk to them and you're using all these medical words, medical jargon, and they're really just kind of nervous and thinking about them. And I think just taking a second to say, hey, how are you feeling, instead of kind of getting in our own heads about what we need to be doing, is more important maybe for them.
I think our whole industry is transforming, and I think we're getting more to patient-centered care and making them part of the decision process and taking ownership of the whole perioperative procedure, not just the intraoperative piece. So I think that's important.
The ASA is committed to advancing the practice and profession of anesthesiology, and they need your help to do it. Over the past year, ASA President Jeffrey Plagenhoff has engaged many groups in discussions to promote collaboration, unity, and teamwork. Dr. Plagenhoff has appointed a multi-stakeholder ad hoc planning committee and will facilitate this winter a strategic dialogue summit. This session at Anesthesiology 2017 gave members the opportunity to take part in an open dialogue with leadership. You can take part by emailing your ideas to j.plagenhoff@asahq.org. The education programs at Anesthesiology 2017 offer detailed research and advice from leading experts. This panel session addressed how women can be better negotiators.
Women think they need to take this kind of adversarial, competitive approach to negotiation, which men usually take, and which we think is what negotiation is. But in fact, that doesn't work for women. We don't like it when women come on too strong, when women seem bossy, difficult, threatening, and decades of negotiation scholarship have shown that taking a more collaborative, problem-solving approach, what do you need, this is what I want, this is what I can do for you, can you help me, what are your problems, actually produces better agreements for both sides. So learning to negotiate in a way that actually most women are more comfortable with, sharing information, brainstorming, is actually superior. So feel good about your inclinations, but do it more.
If negotiating makes you nervous, try to role play with someone you trust. Review things that might make you lose your composure so you can practice staying calm. A product, service, and resource showcase. This week, the Connection Center has been the place for attendees to explore, recharge, and engage.
The ASA is the premier anesthesiology meeting in the world.
There's lots of things to see here, lots of things to learn.
Things that I've learned here, I can safely apply to what I do in emergency departments in Jamaica.
The Connection Center is also home to poster sessions featuring medically challenging and rare cases from a wide breadth of populations who are treated with anesthesia.
It's an absolutely wonderful opportunity that we get to present here at the ASA, especially from the residents' perspective. We get to share some of our medically challenging cases, for example, abstracts and research that we're undertaking, and allow to share that with the medical community at large and anesthesia in particular.
Shortages of anesthesia drugs can have a ripple effect on patient care. Drug shortages may result in treatment delays, cancellation of elective cases, and higher morbidity. There has been a dramatic increase in the number of critical perioperative drug shortages, such as propofol, neostigmine, succinylcholine, and epinephrine, among others.
We can be at the forefront of many of the decisions that are being made in terms of regulations. We should be interacting more with pharmaceutical companies, and then we have to find alternatives, and that's where research comes in finding other drugs that can do the role or the drug job for us.
The ASA is committed to providing members with the latest updates on care measures. This session explored different techniques for blood management in cardiac surgical patients, an important topic for quality reporting as it is a proposed measurement through macro.
There's over 14 million units of packed red blood cells transfused annually in the United States alone, and the abundance of those are actually transfused in the perioperative arena for major surgical procedures. It's extremely costly, and it's also been associated with significant risks of morbidity and mortality.
What do obstetric patients want in 2017? This panel provided key advice for navigating patient requests, especially with those who seek limited pain interventions. Often, patient satisfaction may be linked to the amount of perceived control and decision-making during labor. You can have the patient participate in the process by offering her options to choose from and making an effort to be perceived as a partner. While safety is a top priority, aim to be respectful and inclusive of her birth plan. Physician anesthesiologists have the opportunity to be team leaders in the battle against maternal mortality and morbidity. In obstetric emergencies, team training and crisis resource management can be valuable tools. Among the key takeaways of this session are to go beyond the checklist in an emergency. Rehearsed, choreographed CPR can lead to improved outcomes. The ASA offers many recommendations for patients and providers. Among them, fasting guidelines before major surgical procedures. The ASA recommends 2, 4, or 6 hours prior. However, guidelines in children can vary by provider or service location.
The takeaway that I would like to leave people with is the thought that maybe we should revise them not as fasting guidelines, but rather reframe them as feeding guidelines and actually allowing children to have clear liquids up until 2 hours, formula, breast milk, and so forth from 4 to 6 hours, but actually trying to encourage parents to feed and let their children drink in advance of the operation so that they're better hydrated.
Human beings, we're all different. We're not all the same, so it's hard to dictate the real borderline, but we need really good evidence. We need to have more good evidence to make those guidelines.
Much more education is on the way from Boston. Remember to share your moments from this week on social media using the hashtag ANES17. For now, I'm Ed Highland, ASA TV.